it a lecture. It's very important to talk about lactation and breastfeeding, as this is a very important role for the mother and a major preventive measure for promoting health, especially for the new generation. So our objective from this lecture is to identify the normal physiologic and anatomic changes of breasts during pregnancy and postpartum, define colostrum, describe the differences between colostrum and human breast milk, describe how to treat common postpartum abnormalities of the breast, identify the advantages of breastfeeding, and describe the common challenges in the initiation and maintenance of lactation. So, if we are going to talk about the physiologic and anatomic changes of the breast glands, tissue, and nipples increases in size. Area color darkens, and some veins under skin might become visible. This to promote enough nutrients through more blood flow to increase in size and to build the glands, the milk producing glands. Also, the estrogen, progesterone, human chorionic gonadotropin, cortisol, insulin, prolactin, and placenta lactogen, they all play important role in preparing the breast for lactation. So we will have some anatomical change, and then we'll talk about the hormonal and the physiological change. First, they will hypertrophy and asymmetrical differences. This is normal, but it will be more augmented with the hypertrophy of the breast. So you might have a complaint from the patient or panicking. You need to inform them that this is normal. It is no other breast is like the other one inside. There is a slight difference, but it will be more augmented during pregnancy. Stretch marks may appear over the breast. Also, soreness or tenderness will be developing, especially in the first trimester. Visible veins might appear. Lumps and bumps can be felt, and the breast will be pointing downwards to help the function of breastfeeding the fetus. The nipples will change and they will darken in color. They will widen, especially, and the areola will be widened. Also, the Montgomery tubercles will hypertrophy, and the nipple will be pronounced and elongated, and they might leak some milk drops or fluids from the second trimester. Right. Two things why the Montgomery tubercles are important, because they produce the wax that will help protect the areola and the nipples, especially with this growth and during suckling of the baby. Also, the thing leaks. A lot of patients will say this is a sign of, traditionally, it's a sign of early labor or that labor is coming soon. This is not true, and we will understand why later in our slides. Here are a slide. It shows how the breast gland and the breast tissue and the milk duct will hypertrophy. Also, the changes that you can notice from early childhood to puberty, pre-pregnancy, and then the pregnancy. Also, the change in the position. This because it will be functioning for breastfeeding the baby. If it is not pointing downward, it will not help the fetus to take the breast and start suckling. When we go for the physiological changes, estrogen and progesterone prepare the breast to make milk, and these are produced by the placenta during pregnancy. They have two major roles. They increase the size and number of milk ducts, and they suppress the body from making large amount of breast milk until after baby is born. So because they are produced by the placenta, they will be there as long as the placenta is there. With delivery, we deliver the baby, then in the second stage, then third stage, we deliver the placenta, right? And by this, there will be a sudden drop of the progesterone and estrogen. Also note that during intrapartum, what starts? Oxytocin. These are the two other two important hormones, which is oxytocin and and prolactin. Those are the ones responsible for ejecting milk and producing milk. So you produce milk, it will store in the glands, and then it will be ejected with the suckling. It will be ejected from the breast ducts to the baby mouth. So how this happened? Prolactin helps the breast make the milk, and that's why it is called hormonal halib, prolactin. Even a patient having not pregnant and she have some breast tenderness or increase in size, or she have white or transparent discharge, you have to check on the prolactin. It's one of the causes for amenorrhea or irregular cycles or hypomenorrhea. Here in pregnancy, it is produced to produce milk, and it is secreted before delivery, and it will store the milk produced will be stored in the milk ducts, but there will be no oxytocin that will eject the milk outside of the gland. So by this, if you have the store, which is the milk gland or the in the breast filled with the milk due to prolactin, any increase or mild increase in this milk will overflow. That's why it will sip from, or it will drop few drops of milk from the second or third trimester before pregnancy. It's not a sign of labor. So, however, with each release, body will produce and store more milk. So it will become, you will find that oxytocin and the prolactin, they are produced in pulsatile fashion, not like the progesterone, the estrogen. We can see here the oxytocin and the milk ejection reflex, which is produced by suckling, and this will increase the production of the milk. How we will look at it when we see, you can see here this graph, and you can see that in the long axis we have the time of pregnancy. So we have the pregnancy, then we have birth, and this is represented by the yellow column, and then we have the postpartum, right? We have four hormones. On the left side, you will see the blue is progesterone, then green you have prolactin, and you have estrogen, and you have oxytocin. Okay? Remember this graph, it comes in questions many times, and it is very important to understand the physiology. And you can see here on the right of the graph, after the yellow line, you have white and gray columns. This represent breast feeding timing. So look at the relation. Progesterone, estrogen, we said it is produced and it is responsible about what? Forming the breast gland and increasing the size and preparing the breast for producing milk. So this will be high and increasing with the placenta growth. It will increase. You can see there is an increase in the blue and the red line, estrogen and progesterone, right? Then you have prolactin. Prolactin is also produced by the placenta and from the pituitary gland. However, you are producing now the milk, right? It is produced, but not in a pulsatile manner, and it is increasing a little bit to fill the glands with milk. That's why if there is some, if it is overfilled, it will seep some drops of milk. However, during labor, which is birth, it will start, the oxytocin will start, it will be released and up and down. That's why the contraction of the uterus, and that's why after delivery, you will have pain, episodic pain, and the patient will be complaining that sometimes she will have contraction or tummy pain due to the contraction of the uterus and the release of the oxytocin. You can see that oxytocin will be coming produced first, then the milk or the prolactin will follow. So as oxytocin is stimulated by suckling, it will drive the production of the prolactin, and the prolactin will produce the milk. So the more the baby need milk, it will produce more. The contraction will increase, and the production will increase, and it will follow. No suckling, there will be drop in the oxytocin. Prolactin will start to decrease by time. So these are the relation between the four hormones for producing and ejecting milk, and also the relation to pregnancy, intrapartum, and the postpartum period. When we talk about colostrum, I know that you took it in pediatric, but let us just refine or recall some of the information. On the left, you can see the bottle with the dark yellow or the yellow milk or yellow fluid. This is the colostrum. It is rich in immunoglobulins, and this is the first production of milk. And this is the first batch of milk produced. So it is yellow compared to mature milk, which is more whitish. Also, it is rich in immunoglobulin and in antibodies. In comparison, and it is both have, but this is more, and also to lymphocytes produced by the milk. So it gives the passive immunity. Colostrum is secreted first to second day after delivery for about 3 to 6 days. So it is usual. Not all patients will have milk from the first day. And this is the first complaint you have to remember. If the patient tells you, I don't have milk from the first day, you have to reassure her and ask her to continue pumping or breastfeeding the baby, and milk will come. Derived also by good nutrition and hydration. So it will finish within 3 to 6 days, and mature milk will be produced, and this timing will be the transitional period. Then we move to pure mature milk, and this will be the mature milk within 2 weeks almost. The colostrum contains secretory IgA. The major component of breast milk in general are protein, lactose, water, mineral, and fat. The beta protein synthesized exclusively in human breast milk، يعني ما نلقاها في cow milk or goat milk وغيرها. بالمناسبة أقرب الملك اللي موجود for human milk are not cow milk, which is now produced or used to produce the formula. It is the goat milk and the donkey milk. But for us احنا طبعا اللي موجود في الماركت دائما هو الكاو milk and the goat milk. So goat milk is much better than the cow milk. Unfortunately, it is more expensive, but you have to know. However, what is exclusively in the human breast milk are casein, lactoalbumin, and beta-lactoglobulin. Here we can see the period where colostrum is first produced or introduced or and production happens. However, it starts from the second trimester. That's why some drops can happen from the mothers during pregnancy, and it's not a sign of early labor. It's just that the milk glands are full and these are overflow. By birth, up to 2 to 4 days postpartum. Then mature milk will start, or transition milk will start for 2 weeks. Then the mature milk after the 2 weeks. If we look at the comparison between the colostrum transition milk and mature milk, we will see that it is rich in immunoglobulins and immune cell growth factors more than the others. It is more concentrated. This is less concentrated. Also, we can see that the kilocalorie are different. Also, the amount of milk will increase by day. So the production in the first 24 to 48 hours of colostrum, you will have 6 to 10 ml per kg per day. Second day, it doubles almost. It doubles to 13 to 25 or more. And on third to 14th day, we will have transition milk. And by 2 weeks postpartum, we will have the full milk. What are the components that we will look for 100 ml of colostrum compared to mature milk? We can see that calories are fixed for the colostrum, but it is variable for the mature milk. This is why it depends on genetics, it depends on the type of food and the hydration concentration. So it might be from 58 to 72 kilocalorie per 100 mLs. Like, what about protein? Protein is much higher in the colostrum and less in the mature milk. For the IgA, it is more in the colostrum, less in the mature milk. It is there, but it is less, almost the half. Casein is almost the same. Lactoferrin is more in the colostrum, double the mature milk. Lactoalbumin is almost the same. Total fats are more in the mature milk. It is high in both, 2.9 and compared to 4.2, but it's more fat. So high protein and colostrum, higher protein. Higher fat is in the mature milk. Lactose is less in the colostrum and more in the mature milk. Cholesterol is higher in the colostrum and mature milk is less. So only the fat is higher in the mature milk. Well, whether the protein and the cholesterol are higher in the colostrum. طبعا advantages of breast milk or breastfeeding. There are many advantages of breastfeeding with, on the baby and the mother. So it is breast milk is ideal food for the newborn, especially to start and preparing the digestive system, which is first introduced to food. It start with the colostrum, and then the transition into transitional milk and mature milk. Then it is inexpensive. And every mother in the world, she can produce milk, so it is inexpensive. Otherwise, if it is going to be paid, how this will be fair for the babies and how we can raise. So دي من حكمة الله إنها it's inexpensive, produced by the mothers, and usually in good supply. As baby is need, as he require, the more production will happen, provided the mother is not malnourished. It provides the newborn with passive immunity, and maternal lymphocytes. It accelerates the evolution of the uterus because suckling stimulates the release of oxytocin, which help the evolution of the uterus. And we know, and we will take in the lecture of postpartum, the rate of evolution of the uterus in the postpartum. The fourth is the emotional bonding between the mom and the newborn, and this is now expressed about early skin to skin contact or the monkey grip, and putting the baby as soon as it is born to the mother breast and the skin to skin. Now, a lot of hospitals, they will announce they are baby or mother friendly, and they are promoting for early skin to skin contact, which is the newborn is as it is born, it will be left on the mother chest to promote this bonding and initiating this bond. Also, they have promote for breastfeeding, of course, and not the formula. Moving to the challenges of initiation and maintaining breastfeeding, and this is very common. And we are talking about this because we want to help mothers and we want to promote for breastfeeding. A lot of companies, drug companies, milk formula companies, they want to promote for the formula. And a long time ago, there was no regulation to prevent them. And what happened? They promote that the formula is better than the breast milk. And the modern woman will be not breastfeeding, it will be using the formula. So educated, this was a scam. They they wanted to make money, and they want those babies to have sickness and diseases, and that's the reason. There is no evidence that formula is superior to breast milk. And that's why we want now to help the mothers outcome any challenges for initiating and maintaining breastfeeding. Note that some challenges are in the initiation and they want to breastfeed, but the initiation they have a problem. And some are at the maintaining of the breastfeeding. And this is a commitment for 1 to 2 years. And some will be breastfeeding for 2 years. So it's a commitment. So maintaining breastfeeding is also a challenge. Like, what are the main complaint or the usual complaint you would hear from any patients or relatives? There is no milk is coming. And we talked about the mechanism and the physiology and when is the colostrum is expected to be produced. In some instance, it is only produced up to second day or third day, second day of the of delivery, not the first day. So continue to try to breastfeed, use pumps, good hydration, and use the right technique for the baby to breastfeed. And we'll be talking about the technique to how to breastfeed and initiate the reflux of the baby for suckling. Because some babies they don't know even how to suckle, or not all reflexes are developed or well developed. Some are a bit lazy. Some they need some motivation for the reflux to happen. Like it's a reflex. So it's if a reflex is happening, it needs a stimulus. So how to do the right stimulus for the baby? Be talking about that. Second thing, that baby is in ICU, especially during the Corona and the COVID. Student babies were isolated or they were in the in ICU, or we have a lot of now of C-section or prematurity. They will be in ICU. NICU is not the ideal place for breastfeeding, and it's very difficult. Usually, they will discharge the mother. The NICU will be the baby will be in NICU. Then you have to educate the patient about pumping and storing the milk. There is bags for the fridge and bags for the freezer, and how many hours you will be keeping them, and how what is safe and when to discard the expired, how to keep it in a safe and clean manner, how to collect it. Very important to talk about this, and there's a lot of videos about this. Mother, also you can use some certain medication. You have to go for the least and the medication that are not secreted in the milk. Milk is working not with the baby all the time. Regulations have changed in the Saudi Arabia, and this is really the vision of 2030 and how it moved systems to support the mother. سو عندنا ساعة الرضاعة، في زيادة في عدد أيام الإجازة، إجازة الأمومة. All this إيمانا من الوزير ومن الوزارات ومن الهيئات لأهمية البريست feeding and the motherhood. And we should be, as doctors and healthcare providers, supporting these initiatives and promoting this in our campaign. This is the largest and most cheapest way our health prevention method is to give breast milk. You will decrease the disease for the baby. You will increase the emotional bonding between the mother and the baby. You will increase the stability of the mother mood. You will be offering the immunity will be boosted, and also allergies. يعني asthma and allergies are increased in those who doesn't take the breast milk. So we find that things are changing towards supporting the mother. Breast pain, this is we talked about it, whether during pregnancy or during breastfeeding, and mostly because of the incorrect or the no regular breastfeeding. لما يستخدموا between formula and breastfeeding, some clogging or filling of the reservoirs or the breast glands will happen, and this will cause pain. Also, wrong techniques can cause cuts or injuries to the nipples, and infection can be introduced. The last thing is cosmetic reasons. However, we talked that cosmetic or breastfeeding is not a reason for disfiguring the mother. It will help with returning of the tummy and the involution of the uterus. The breast should always, you have to keep exercise, and by doing exercise, the breast or the pectoralis muscle will support the breast, and there will be no redundancy, or there is no will be sagging breast. So it's not, and doing the right technique, it will prevent the injuries and deforming of the breast and the nipples. Okay, what are the common postpartum breast complications and management? Engorgement and pain, this is the most common. Cracked nipples, mastitis, galactosele or plugged ducts, and breast abscess. All these are differential diagnoses, and you have to know the history and the physical exam and the complaint that you might see. It will, in exams, we don't bring it as enumerate, or we will talk about a case scenario. Okay, a patient came, she has these complaints, 1 and 2. What is the differential? Or sometimes, if we are going to a higher, especially in the second exam, we will go for how you will treat. So, treat from the history means that you got the diagnosis, and then you know what is the management and the treatment for this case. This is the application of the knowledge. So, you have to differentiate between engorgement and pain. And this means that milk is engorged in the breast gland, and usually there is mild fever, no much of fever, there is no signs of cracked nipples, and you will have a history of irregular breastfeeding, and you can feel some bumps or lumps in the breast. طيب, what is the rest? The cracked nipples. They will have cracked nipples, and this will be pain and sourness, and it has to be. This means there is a poor technique, and you have to educate the mother. Also, apply some medication to help, like bibenthine, antibiotic and antifungal, and moisturizing cream that will help the nipples to heal, protected from cracks and injuries. Mastitis, this is like cellulitis. Remember that mastitis is infection of the skin of the breast. So usually if there's infection, means antibiotic. Infection means fever, so we'll give antibiotic. And pain, so we will give paracetamol, brufen, anti-inflammatory medications. طيب, galactosele is trapped or clogged ducts with milk. This is sterile infection. There is no sterile inflammation. There is no infection. So this will do massaging, and you will give some warm and cold packs that will help ease, and you will move the breast massage in a circular way and expressing way till this clogged or galactosele will be resolved. A breast abscess means there is pus. So any pus means incision and drainage. Then antibiotic and painkillers and antibiotics. Done. In all these cases, do we stop breastfeeding? No. You tell the patient, continue breastfeeding. Whatever happens, continue breastfeeding. Okay. Here is the cracked nipples, and we can see, and it can bleed or we can feel. And we said this is due back technique. And also this can be a reason for introduction of infection. So either cellulitis, or it can cause breast abscess. This is an area we can see here, redness of the breast, and this is called mastitis. Remember, it is like cellulitis. Here on the left side of the picture, you can see the abscess, and here this means inflammation with collection of pus. You need to do incision drainage, cover with antibiotic, and painkillers and antibiotic. What is the right technique for breastfeeding? We will see here the steps, because part of your job that you educate patients about the right way for breastfeeding. So, if you want to do, first you have to size with the areola. Areola is used with the lower lip of the baby, of the newborn, and then you will take the other breast, the upper part of the areola with the thumb, and then you will have the nipple over the furlum of the lips, and then over the upper palate of the feet of the baby, and this to the back of the throat. This will initiate the suckling reflex. So, as I mentioned, some newborn, preterm, for any reason, reflex should be initiated. It's not a spontaneous reflex. Sometimes it has to be taught for the fetus or provoked. So this is the right way, and this is the right way to size and not let the baby bite on the nipple and cause cracked nipples. They need to bite on the areola, so it will squeeze the milk outside and feed the baby. If they press on the nipple, they will have less milk and it will be painful and it will cause cracked nipples. So this is the way. Then we will be talking about how we will hold the baby. So look at the ways. We have different ways. You have the cradle, the cross cradle, and the football technique and the laying technique. So the cradle is when the fetus head and the hand of the same breast is under the head of the baby. The hand or the arm is under the breast of the baby. This is cradle. Cross cradle, where the hand holding the baby is the contralateral arm holding the baby, and the mother is directing the breast to the fetal head from the other side. This is called cross cradle. Football, this is the American football, not the soccer football. This is the American football where they hold the baby like a football, American football. This helps mainly with the twins. When the mother have twins and she want to breastfeed both of them at the same time, they can use. Also, some women will be preferring the football technique or hold. The last one, mother is tired, breastfeeding. The patient will breastfeeding as the baby required. This is usually in the beginning, every 3 to 4 hours. That means that she will be awake or sleep will be interrupted many times. Then you can do the laying down technique. Both of them will be laying in the same axis, and the mother can let the baby breastfeed. For the last slide, we here have this is a slide showing real numbers and real contacts, emails, and this is a form where it supports your patients. This I took from the Ministry of Health, and it was distributed. I took it maybe 2 years back. I was with the ministry as a consultant, and we worked on the many projects. One of them is still ongoing, is the surrogate just breastfeeding surrogate, يعني المرضعة أو المرضعات يصير لهم directory. The other one is the breast milk bank. However, believe it or not, a lot of females are finding difficult, or mother are finding difficulty with breastfeeding. And sometimes because of all the stress, all the responsibility, they don't have the time to go and they want a fast answer. We have 937. Also, these are specialized centers that they can be contacted where happily and willingly they will give the support, even transfer to clinics if needed. So you can use this one to refer your patients from clinics, or even your family and friends if they need help. Thank you. Any question?
جزاك الله خير دكتور.
واضح، يعطيك العافية.
يلا يعطيكم العافية إن شاء الله. أعتقد إنه في عندنا محاضرة بكرة، إذا تبغوها بكرة ولا تبغوها بعد العيد إن بيرسون عادي، بس قولوا لي إيش تتفقوا عليه عشان نرتب.
تمام، يعطيك العافية دكتور.
يلا موفقين إن شاء الله، مع السلامة.